fighting inflammation to prevent permanent lung damage from the virus. Experts predict that 70% of the population will get infected before this pandemic slows down. There could be a second wave and maybe a third wave of this virus. And both waves could be deadly. It is likely that we will all get exposed to this deadly virus before there is a vaccine or an effective treatment. It is true that majority of individuals are asymptomatic or experience only mild symptoms. And these folks may get silent hypoxia, which is dangerously low blood oxygen levels with serious lung inflammation. But they feel fine and don't seek any medical care. Others are overtly symptomatic, they cannot breathe and have hypoxia with lung inflammation. These patients need to be treated in hospitals and may require a ventilator. Severe cases represent an exaggerated inflammatory response rather than damage from the virus itself. This is called cytokine storm, where the immune system attacks the lungs and other tissues rather than just fighting off the virus. The result is widespread inflammation in the body. This mainly affects the lungs but occurs throughout the body. It contributes to blood clots, which are causing stroke in affected patients. When the inflammation finally resolves, healthy lung is replaced by fibrosis and scarring, with permanent loss of lung capacity. This will limit your physical stamina going forward and may ultimately shorten your life. Those who survive a serious infection are expected to live 10 years less as a result of permanent lung damage that they sustain. Obviously, we want to avoid both silent hypoxia and cytokine storm in order to save our lungs. There is still so much we can do to improve our chance of having only a mild case of the virus. We need to focus on fighting inflammation. We always knew inflammation was bad. Inflammation is the root cause of so many chronic conditions that are already killing us, like arthritis, heart disease, and others. The idea is to put a check on inflammation. Let's discuss 6 things we can do to counteract inflammatory processes throughout our bodies. Starting now may make the difference. So here are 6 steps to block inflammation. Number 1. Adopt an anti-inflammatory diet. Think eating Mediterranean diet. Start your day with a whole grain such as steel-cut oatmeal and fruit like blueberries, blackberries, strawberries, cherries or oranges. For dairy, limit yourself to Greek yogurt or cottage cheese. Make sure your day includes a salad. Load up on leafy green vegetables such as spinach and kale. Then add colored ones like tomatoes, peppers and radish. Have an avocado and a cup of mixed raw nuts every day with plenty of almonds and walnuts. For meat, choose a fatty fish like salmon, mackerel, tuna or sardines. Have a lot of low-fat snacks throughout the day after every 2 to 3 hours. You can take carrots or an apple, so you never feel too hungry. Finish your meals by 6 p.m. with more veggies or fruit snacks if you need. Number 2. Get rid of inflammatory foods. The major culprits are refined sugar and high fructose corn syrup. These are the major sources of inflammation and cause far more heart disease than cholesterol ever did. We need to stop purchasing foods and drinks containing high fructose corn syrup or added sugar. The same is true for refined carbohydrates such as white bread, white flour, white rice, pasta, pastries, and a lot of breakfast cereals. Get rid of vegetable oils and seed oils. Only use extra virgin olive oil. Stop excessive alcohol and processed meats. Just stop, throw it out, and don't buy anymore. Number 3. Make time to exercise. Exercise is known to lower inflammation. So get moving. Start doing some sports, jogging, yoga, or tennis. Exercise sends a clear signal to the 50 trillion cells of your body that you intend to live and they respond with life. The American Heart Association recommends 150 minutes per week of light exercise such as walking. This means walking for 30 minutes 5 times a week. Try it with small dumbbells in your hands otherwise. Number 4. Lose weight. The vast majority of people are too heavy. Just be careful. Obese individuals are hit harder by the virus pandemic. Set a goal of losing 10% of your body weight over the next year. The trick is to eat strategically, but you won't lose weight without exercise. So learn to lose weight by eating right and exercise. Number 5. Manage your stress. Emotional stress signals your body to produce the hormones of stress. Many of us are addicted to stress. We thrive on it. We don't feel productive without stress. But stress creates a highly inflammatory state throughout your body as if you are literally preparing for a battle. Stress is inevitable from time to time, but living with significant chronic stress is unacceptable. It is time to be mindful of your emotional state. You can catch yourself. Do what you need to do, but don't allow yourself to feel stressed out. Number 6. Take supplements. We can load up on additional antioxidants. These are very effective in neutralizing inflammatory molecules, also called free radicals or reactive oxygen species. Items like turmeric, garlic, ginger, grapeseed extract, glutathione, vitamin D, vitamin C, magnesium, and much more. Vitamin D deficiency is widespread, and it is most common in people with old age or people with dark skin or people who live indoors and don't expose their skin to sun. These people are hit hard by the virus, and proofs are coming out. I have already done a video on it. I take these supplements and plan to continue until the virus pandemic is no longer an issue. Feel free to do the same. I always recommend discussing with your personal physician before starting any supplement. The global spread of the virus is frightful. We have entered the COVID-19 era and may be living with this virus for years to come. Despite all the precautions, getting infected may be inevitable. It is time to really take charge and use this pandemic as motivation to transform yourself. Now more than ever, our health is a matter of life and death. They say things will never be the same. Good luck and stay safe. Please like this video and subscribe to our channel. Leave your comments below. Your feedback is very much appreciated. Thanks.